Hi, everyone. My name is Shaina Hecht. I'm one of the Associate Directors of Pediatric Global Health Education here at Riley, as well as one of the Pediatric Infectious Disease Doctors. I'm going to spend a couple of minutes today talking with you about global health education in the Department of Pediatrics. So overall, our first goal is to educate all of our pediatric residents to cultivate aptitude and skills and cultural humility to increase their knowledge of health conditions affecting children globally and to strengthen understanding of local resources addressing health inequities. So here's a pyramid that describes our pediatric global health curriculum for our residents. At the bottom, you can see education that all residents in our program get, which includes noon conferences, clinical experiences in our outpatient clinics, didactics, and simulations. Then, as you move up the pyramid, residents with additional interest in global health can find additional opportunities. Those that would like to participate in an international elective, those who would like to apply to be a member of our interdisciplinary global health residency track, and then those with global health career aspirations, want to be involved in global health research, or want to receive their certificate of tropical medicine degree. So right now, I'll spend a couple of minutes talking about a few initiatives from the bottom of our pyramid. The first activity I'll discuss is our Simulation Olympics global health cases. So each residency class has a yearly Simulation Olympics day, and this is 1/2 day of protected time where residents have the opportunity to go through many different scenarios. And a lot of these are high stress, high acuity patient situations, such as a patient having a seizure that requires a lot of teamwork. But in the last few years, we've also incorporated 3 different global health cases focusing on cultural humility that give you some common scenarios that you may face in your clinic or on an inpatient rotation in a safe, simulated space to foster learning. And we feel these are just as important as learning how to manage the high stress scenarios. We also have a morning where we learn more about how to care for our immigrant and refugee patients. And this is a morning of case-based curriculum facilitated by one of the global health educators. And it starts with a pre-session video lecture describing our immigrant and refugee patients in Indianapolis and introducing the concept of cultural humility. And this was actually the idea of a few of our pediatric residents on the global health track who created this module for their scholarly project as they felt like they wanted more education on caring for refugee and immigrant patients here in Indianapolis. And they actually presented their findings at our Global Health Scholars Day. And so really the aim of this curriculum is to provide instruction that helps learners develop skills critical to providing culturally effective medical care to our immigrant and refugee patients here in Indianapolis. Another activity we've incorporated into one of your outpatient rotations is the goals module. So this was created by the Midwest Consortium of Global Health Educators, and it's a suite of free educational products used to prepare medical providers to work in resource-limited settings. And we know that not all residents want or can participate in an international rotation or would like to work in a resource-limited setting. But the goal of our program is to increase global health medical knowledge for all residents and provide opportunities to consider how healthcare may be practiced in other settings. Additionally, we have incorporated an interpreter experience into our ambulatory rotation. And this really is to understand the function of interpreters within the healthcare system and how best to utilize their services. And we know that residents don't always have the opportunity to talk with interpreters about how best to utilize them. And so you can use this time to get tips and tricks from the interpreters and to think about using an interpreter from the patient perspective. And sometimes reflecting on your own biases or these thoughts can be challenging when you're in the middle of a busy day of patient care. We also have residents work with Dr. Einhertz in the Marion County Refugee Clinic. And she's had decades of experience working with immigrant and refugee patients here in Indianapolis, but also in resource-limited settings, and is a wealth of knowledge for caring for patients that came from other countries. And finally, for those with additional interest in global health, but cannot do an international elective, we offer a domestic global health elective. And this is a personalized elective that we design based on your individual interests. And we can offer one-on-one Spanish lessons for those who would like to increase their Spanish proficiency, virtual Swahili lessons for those planning to go to Kenya or a country where people speak Swahili, online interactive global health modules. We provide time in various clinics working with patients living with HIV, those experiencing homelessness, more time at the refugee clinic that I previously mentioned, or at our travel clinic, seeing patients who present for pre-travel evaluations. And we hope you take time during your elective to reflect on one's personal biases that may affect decision-making when caring for diverse and vulnerable populations. So I hope this presentation has helped you to understand some of our global health education initiatives here at IU. Please don't hesitate to reach out with any additional questions. Thank you.